The Good Samaritan Pharmacy and Health Services provides free prescription medication to people who cannot afford it. No one should have to choose between buying food or buying medicine. We either dispense it directly from our pharmacy or enroll the patient in a manufacturer's compassionate care program. We have also established a free walk-in medical clinic in which a patient can be seen by a doctor and walk out the same evening with their medicine in hand. The following is a story about one of our patients. Mary G., a 59-year-old diabetic patient, walked into our free walk-in medical clinic one Wednesday night in tears. When our volunteer receptionist asked what was wrong, she told her that she had used her last vial of insulin and had no money to purchase more. She had already owed money to the hospital for her last emergency room visit, and the doctor who had treated her in the past had no more samples to give her. That same evening, after completing a brief form determining her limited financial ability, she saw a volunteer nurse who took her vitals and checked her blood sugar levels. She was then examined by a volunteer physician who wrote a script for the insulin she needed. The script was filled on site by our volunteer licensed pharmacist through our alliance with the LECOM School of Pharmacy, and Mary then had enough insulin for the next 30 days. She then sat down with one of our volunteer patient advocates who researched all the medications Mary was taking, helped Mary to complete an application to the manufacturer's compassionate care program, and immediately faxed it in to the manufacturer. 2 weeks later, Mary received a letter from the manufacturer saying that she would be receiving insulin directly from them on a regular basis, free of charge. We were able to assist her with several of the prescription medications she is taking, either by dispensing it directly from our pharmacy or from the manufacturer. When Mary left our pharmacy that night, she was again in tears, but this time the tears were of joy. "God bless you," she said. "Without your help, I probably would have died." You can help people in the same situation as Mary. For a tax-deductible contribution of $30 would give an asthmatic patient receive a 6-month supply of Ventolin, a $325 value to the patient. For $50 would fund 1 month of meds for a diabetic patient, a $450 value to the patient. $75 would supply a year's worth of test strips to a diabetic patient, value to a patient $275. $250 could sponsor one patient for a year, a $3,000 value to a patient. $350 would sponsor a medical clinic for one night, a $2,400 value to the patient. A $700 contribution provides 3 months' lease of the software program required for compliance of pharmaceutical dispensing. $900 would supply 6 months' lease of the software program used to obtain free medication through the manufacturer's compassionate care programs and track patient compliance. A contribution of $1,400 sponsors the medical clinic for 1 month. All your contributions are tax deductible